Good afternoon. I'm Courtney Butts. Thanks for tuning in for today's brand new Healthline 3. And joining us now is Dr. Miles Sugar with Willis Knighton Vascular Surgery. Thanks for joining us.
Thank you for having me.
Yeah, so tell me a little bit about what you do at Willis Knighton.
So I am a vascular and endovascular surgeon. So I treat arteries and veins throughout the body outside of the heart. And that can be either with open surgery or with what we call endovascular treatments, which are stents and angioplasty balloons, things like that, to try and open up blood vessels throughout the body.
All right, yeah, so sounds like pretty intricate work. So we'll talk a lot about what you typically do for a specific disease that we're talking about today, that's our topic. But with Healthline 3, it's a 30-minute conversation where we like to focus on ways to live a healthier, happier, and pain-free life. And we'll be taking your calls. So with Dr. Sugar, we'll be answering those questions live in the studio today, and we're opening those phone lines soon. But make sure you're in a quiet room when you call with your TV turned all the way down. And that number is going to be on your screen. It's 318-219-4569. We'd love to hear from you. And with that being said, our topic today is peripheral arterial disease. And this is something that you're very well versed in, something that you treat often with maybe surgical interventions. But before we get into it, tell us first, what is PAD or peripheral arterial disease?
So atherosclerosis or arteriosclerosis is a disease that happens throughout the body in the walls of the arteries. The term actually means hardening of the arteries, and it's a plaque buildup in the walls of the arteries. This is why your doctor cares about your blood pressure and your cholesterol and things like that, because those all contribute to this plaque buildup along the walls of our arteries. Mm-hmm. When that plaque buildup happens in the arteries going to the legs, then you start to get symptoms from getting poor circulation in the legs. The legs are starving for blood and for oxygen, and you can end up with limb loss if this is not treated appropriately.
Okay, yeah, so it sounds like it's a chronic thing, something that happens over a long period of time.
Typically, yes. We see this as a chronic disease that builds up over time. As these plaques build up, they narrow down and then progressively get to the point where they block off the artery. Mm-hmm. This can happen acutely, though. Patients who either have small narrowings that all of a sudden block all the way off, or if you have a clot buildup somewhere in your bloodstream that can then go downstream and get lodged in the arteries in the legs and cause a sudden shut off of blood to the leg, which can be very severe.
Okay, yeah, sounds like it. So, symptoms associated with PAD, tell me about those and what someone should be on the lookout for.
Sure. So, often patients with peripheral arterial disease start out as asymptomatic. They may have poor circulation to their legs, but their legs are still getting enough blood flow and enough oxygen because the body's finding alternative pathways. As it progresses, then it gets to, the medical term is claudication, and it's a weakness or a pain that gets worse the further you walk. So I tell patients, it feels like you just tried to run a marathon, but instead of running a marathon, you tried to walk down the block, and your legs start to give out on you because they're not getting the nutrients they need. If it gets worse than that same kind of pain can happen even at rest. So that's your legs are no longer getting enough oxygen to keep them healthy even at rest. And then if that progresses, you can get wounds and ulcers, and then late stage, you can get gangrene of the toes or feet, and then eventually limb loss from that.
Okay, and so you mentioned it feels like you ran a marathon, or from just walking across the room or down the block. So is that like a burning pain that you feel in your legs or your extremities?
So it can be, patients will often describe it differently. So it can be a burning pain or a cramping. Typically it's felt in the muscles. So if you're feeling joint pain, that's not this.
Okay.
But it can be that kind of cramping pain, or some people say it doesn't hurt, it just feels weak. My muscles are giving out on me, they're not moving for me. And that's that same, it's that jelly leg sensation that you got when you tried to run too far when you were a kid.
Right, okay. And this is most often happening in the legs, or does it happen in the arms as well? Or, when you think peripheral?
Most often we see it in the legs. Part of that is because the arteries going to the legs are the longest arteries, and so there's more room for this to build up in the body. Also, we rely on our legs to walk, and so you notice it more. You can have similar disease building up in the arms, but because you're not walking around trying to do a handstand all day, your body doesn't recognize that.
Okay, makes sense. Okay, so what causes PAD to form?
So this is kind of the risk factors we see for this. Number one is smoking. Tobacco smoking is associated with this and with the severity of it. Other things are cholesterol and blood pressure, just all of the things that your doctor tells you to be mindful of. Same things for heart health, same things for stroke prevention. It's the same disease process as those things, just happening in a different place.
Yeah, I'm glad that you explained that, because it sounds similar to some of the things you're looking for with heart disease, like with the plaque buildup, with the atherosclerosis, and then the blood pressure and things like that, but it's just affecting your extremities.
Exactly.
Or so. Okay. What about stress? Is stress playing a factor in this as well?
Not as much.
Okay.
The activity of the heart has a lot to, like, as you're stressed, your heart has to work harder. Unless you're running from something, the more stressed you are, your legs are not going to be working that much harder, so you're not going to have that demand.
Gotcha. So that's kind of the distinguishment, because a lot of times stress is associated with increased risk for, heart disease or heart attacks, and so it seems like it's more the lifestyle factors of things that you do put into your body, and then also, maybe smoking is a big one.
Absolutely.
Okay. So how are you someone that would diagnose PAD, or do other providers do that, and how is that process going about?
So the initial diagnosis or the initial suspicion comes with a physical exam. As we're examining patients, are feeling the pulses, and if you can't feel a pulse down in the feet and the ankles, that's very suspicious for peripheral arterial disease. There are confirmatory tests having to do with ultrasounds, blood pressure cuff tests, things like that give us more objective measurements about this. But to start with, it's that physical exam.
Okay. All right. And so you kind of handle a lot of the treatment options. And when we think surgery, sometimes that might be thought of as like a last resort type thing, but with PAD, is this something that you kind of consider immediately?
The first line treatment for a lot of patients with peripheral arterial disease is actually medical. A lot of it is modifying those lifestyle risk factors, working with trying to exercise the legs to the point where the body can overcome this. If that is not successful or limits the patient's ability to do what they need to do, or if we're in a limb-threatening situation, then we move very quickly to surgical or endovascular treatment. Treatments at that point can either be a stent, or we have different types of balloons or Roto-Rooter type devices to clean out the vessels from the inside. And if those are not successful or not safe, then the other option is an open surgery to actually reroute the blood flow around these blockages to get it further down the leg.
Okay, and we mentioned earlier the acute PAD is kind of something that you would want to immediately consider surgery with something like that.
Yes. If a patient comes in with a lower extremity that has acutely gone cold, that's absence of blood flow, starting to get numbness, things like that, that's a surgical emergency. Because if that's not addressed early, then you can get permanent damage or even limb loss from that.
Okay, gotcha. And so take me through the surgical process, because this sounds pretty fascinating. So is this something that you've seen maybe advanced over the last couple of years from where you started with surgery and what you're doing now?
Yes. So the open surgical approaches to peripheral arterial disease are old. Rerouting blood flow around blockages, directly cleaning out blockages, that's well-established surgical care. What's been new and exciting with this is the advancements of the endovascular technology. Being able to, instead of have to make incisions all the way down someone's leg, being able to do it through a needle stick in the groin, go inside and open this up. And the technology of the devices that we're using for those endovascular treatments is constantly advancing, and that's been fascinating.
Yeah, that's cool. So you mentioned cleaning out, so you're cleaning out the artery, right? Is that what you mean? And what does that process look like?
So for the open surgical clean out, it's you make an incision, you find the artery, you open the artery up and you scrape out all the plaque that's
Okay.
blocking it up, and then you sew it back shut. We now have endovascular tools that can do that, that are similar to a rotor-rooter type thing you would use in plumbing to break up the plaque and scrape it out from the inside.
Wow. Okay. And so I would imagine people would feel a difference almost immediately after surgery.
Yes, yes. Of course, there's pain with any sort of surgery and incisions, but patients can differentiate. My foot feels better. I feel the surgery. That's still recovering. But the pain that I have when I walk, that improves almost immediately.
Okay. And we've got our first caller, Tony. Thanks for joining us. And what is your question for Dr. Sugar today?
Hi, Dr. Sugar. I'm a diabetic, and several years ago I was diagnosed with chronic venous insufficiency. Does this lead then to PAD?
Okay, so the diabetes has an association with peripheral arterial disease. It can affect the large arteries that we're talking about as far as peripheral arterial disease. More commonly with diabetes, though, we also see what we call microvascular disease. So the blood vessels that are too small for me to see or work on down in the foot get affected by diabetes, and you can have similar problems to a patient with peripheral arterial disease without having the same kind of blockages in the arteries because those tiny blood vessels are being affected. The other part of your question is that chronic venous insufficiency. That's actually the opposite problem. So we've got two different types of blood vessels. Arteries bring blood down to the feet or bring it out to the tissues. Veins return that blood back to the heart. And so with venous insufficiency, the problem is not a circulation of getting blood to the foot. It's a problem with fluid and blood that gets down there not being able to get back up. And so patients with that get swelling and can get varicose veins, can get ulceration related to that. That is also difficult to heal because the swelling is fighting your ability to heal that, but it's not associated with the same type of arterial blockages that we see in peripheral arterial disease.
All right. Good, great way to explain
Okay,
that.
that's very helpful. Thank you very much.
You're welcome.
Yeah, thanks, Tony, for joining us. And if you are just joining us and you have a question for Dr. Sugar, we're talking about peripheral arterial disease, and you can give us a call at 318-219-4569. And we've got another caller right now. Thanks, Connie, for joining us.
Hi. 2 years ago, I had the artery bypass done on my left calf and by my ankle, and the doctor had cut me from down on the inside of my ankle all the way up to the top of about 6 of my bladder. And he said I had already had 2 surgeries of my arteries getting clogged up. So he would go in there and put stents in there. And then it seems like no time, and the stents would get clogged up too, you know, and he'd have to go back in there. So finally he might have told me, but I don't recall. But anyway, I had a artery bypass, is what he told me. And nowadays, if I wear certain shoes, my left toe, I don't think I'm getting blood, you know, to my left toe, because it just feels like, say, I walked on a hot pavement, you know, and like there's no skin on there, like, you know, someone ripped my skin off. That's how bad it hurts on the bottom of my big toe only. Could that be maybe my blood's not getting circulated all the way down in there since the artery bypass? And I've been having joint horses. That's what it started with, you know, in my left leg. And now I'm having joint horses real bad in my right leg.
Okay. So someone
what would you think that is?
Someone such as yourself with such an extensive surgical history related to peripheral arterial disease, any sort of return of symptoms like that, the first suspicion is always, is there a blockage or a recurrence of the blockage either in the bypass or somewhere around there? So that's absolutely worth being reinvestigated. It is also possible that you can get from the time kind of before each of your surgeries where you're having that poor blood flow and having those symptoms, the nerves in the leg can be particularly sensitive to that. And so you can get a nerve damage from that poor blood flow that even when the blood flow is restored and the blood flow is adequate, you can still get symptoms like a burning or a stabbing type pain that is related to that nerve damage, no longer to poor blood flow, but to the damage that happened to that nerve while the blood flow was so bad. But with your surgical history, you definitely need to get that checked out, especially if you're getting new symptoms on the other leg, because you're, as you well know, very high risk for recurrence of this disease.
Yeah, and also I've had maybe, I think about 3, like Charlie horses in my left leg up on my thigh, not down at my calf, where the artery bypass is. And I said, oh, gosh, Dr. Seguin, could I have your phone number, please? I would like to come see you, please, if you don't mind.
Absolutely. My office is 318-212-8177, and I'd be happy to see you and see what we can sort out for you.
I'm sorry.
You need me to do that again?
What?
All right.
Yes,
318-212-8177.
And it's also on screen if you want to copy it from screen.
Oh, yeah, it's there on the bottom of the screen.
Oh, okay. All I seen a while ago was the number to call to get y'all on the phone.
Right.
Okay, so you're in Shreveport?
Yes, I am at Willis, Knighton North on Greenwood Road in Shreveport.
Okay, well, I'll be giving you a call then because I would like to have a professional like you are, look at it and tell because it's not all the time. It's just sometimes it happens. And, I only had it like maybe 2 times on my left leg up there between my kneecap and my calf. But then it's a thigh,
All right.
when the artery bypass is, I've had no problems at all with it. But now this right leg is starting to do that.
Okay. Well, yeah, we'll be happy to take a look and see what we can do for you.
Thanks,
Well,
Connie,
thank
for
you so
joining
much.
us.
You're welcome.
And if you're just joining us and you have a question for Dr. Sugar, you can give us a call at 318-219-4569. And the number that you see on the screen right now will get you dialed in to talk to you, and then we'll share your number again later in our show. And we have another caller. Oh my goodness. Thanks for joining us. And what is your question for Dr. Sugar? These are great.
Is it my turn?
Yes, Tom,
Yes.
I'm so sorry.
Okay.
What's your question?
I walk about 100 steps, and my right leg, and my back of my right leg, up on the thigh, gets so bad I can't walk on it. Now, if I go and I sit down for literally 10 minutes, I can get up and walk normal again.
Yes, that I couldn't describe it better. When she had asked me about symptoms, if I'd had you on the phone, I wouldn't have had to describe it. That sounds classic for peripheral arterial disease. That's definitely something that if it's kind of interfering with your ability to walk and your lifestyle, that you should see your physician about and see if there's something that we can do to improve your blood flow.
Okay, thank you very much.
You're welcome.
Thanks, Tom, for that question. And if you were just joining us, again, our number is on the screen. You can give us a call and ask Dr. Sugar a question. In the meantime, I will ask more questions. So, we're talking about peripheral arterial disease. And so let's say that could peripheral arterial disease or PAD be something that is indicative of something more serious?
So because peripheral arterial disease is kind of a subset of atherosclerosis, You can have, if you have peripheral arterial disease, you can have atherosclerosis anywhere else in your body. And so the kind of more serious complications then would be heart attacks and strokes. So same risk factors, smoking, cholesterol, blood pressure, but besides just a pain in your legs, you could have a heart attack, you could have a stroke, and so it's definitely not something to ignore.
Yeah, for sure. Make sure you're getting those follow-up appointments, getting checked out. And so we've talked a little bit about, the symptoms, the treatment, but it seems like this is pretty common. How common would you say that this is?
Atherosclerosis itself is very common because heart disease is, I believe, the number one cause of mortality. When do we see it in legs is much less common than when we see it in hearts. Often because it goes unrecognized. I don't have a good number for you, but most of the people who come to my office.
Okay. Yeah, so definitely not as common as heart disease, but it's maybe undetected a lot of times.
Yes.
Okay. And so how long can someone, expect to live with PAD?
So PAD in and of itself is not typically life-threatening. It's limb-threatening, and so it's the risk of those amputations. That being said, because it's association with heart disease, with stroke, the long-term survival of a patient with peripheral arterial disease is related to their predilection for having coronary disease and for having strokes.
Okay, gotcha, yeah. And so we've talked about the treatment options. You mentioned like cleaning it out, and I love how you refer to like, plumbing, getting in there and cleaning the system out. And you also do stents as well, correct? Like tell me the differences of like maybe when you would want to consider one option over the other.
Sure. So the main three kind of endovascular, minimally invasive options that we have are a balloon, which is where you blow up a balloon inside the artery, it opens up that narrowing, and then the balloon is removed, just leaving that open space there to try and open that up. Because you're not supporting that with anything, those can then scar back down and you can have recurrent blockages or narrowing. A stent is then a scaffolding that we can leave behind inside the artery that leaves it propped open to maintain that flow channel to keep it from narrowing back down. And then what's called an atherectomy device, which is those rotor-rooter devices, can go in and actually scrape out the plaque from the inside of the artery, remove that. And those three techniques can all be used in combination with each other to try and get the optimal result for the patient, depending on what that looks like during the procedure. We typically try to do these minimally invasive approaches first, and then if these are unsuccessful or if there are certain factors about the patient's disease pattern that makes them unsafe, that's when we would talk about open surgery as the next option to try and reroute blood flow around them.
Okay, and would that include, so Connie mentioned earlier, arterial bypass? Would that be something that you would consider at that point?
Yes, so one of the most common operations that we see for peripheral arterial disease on the open side is an arterial bypass, and that's finding where the blood flow is good above the blockage, finding an area of healthy artery below the blockage to be a target, and then using either the patient's own vein or using a plastic tube to reroute blood flow around the blockage back to where you've got healthy vessels on the other side.
Gotcha. And what are some of those imaging that you use to, assess that, like the good blood flow and things like that? Is there specific imaging that you use before you go in and operate?
So for the endovascular procedures, that actually is a imaging procedure combined with a intervention. So we do what's called fluoroscopy. We are inside the patient's artery with catheters. We inject a contrast directly into the artery, and then we shoot x-rays, and we can see based on how that contrast either goes places or doesn't go places and how narrow the vessel looks, where those blockages are, and then that can direct our intervention from there. If we're unable to do the intervention, we can still take the information from that test and use that to then guide open surgical therapy.
Gotcha. So we talked earlier about how smoking is a big risk factor for this and can increase the severity, as you mentioned. Can you explain why smoking does that, or how?
No.
Okay.
I wish I could. But no, it's something in the cigarettes
Okay.
causes this reaction in the walls of the arteries, causes the plaque buildup. So it's associated with the kind of incidence of the disease, the severity of the disease. And then when we do any of these interventions, they work better and last longer if smoking has been eliminated by the time we're doing this.
Okay, yeah, so bottom line, stop smoking if you currently smoke, maybe get into a smoking cessation program as well, and see, so that can help and help your outcomes too.
Absolutely.
So, and other factors like changing your diet and maybe doing some of these minimally invasive procedures, which can really help in combination
Yes.
with the lifestyle change. Okay. And so let's say someone is interested, or maybe they've talked with their primary care physician, or they have this diagnosis of PAD. So for them to see you, what is that process? They maybe do those imaging or the minimally invasive things, and then when or how close after that can they schedule the surgery? Is it pretty quick from kind of figuring out all the logistics?
So a lot of it has to do with, like you said, the logistics and the testing. So once there is a concern for the circulation in the legs, then it's time to see a vascular specialist. That could be a vascular surgeon like myself. There are a lot of cardiologists who also do legs as well as hearts. Someone who looks at this disease process to guide further testing, and then from that point make the decision with the patient about what kind of options do we have as far as repairs and what does that timeline need to be. Also, since this is a risk factor for heart disease, again, we need to make sure that the patient's heart is healthy enough if we're going to plan a major operation, because once again, the heart, of course, is going to be more important to us than our legs.
Right, and also maybe checking for other risk factors like diabetes, as you mentioned earlier. That
Absolutely.
could probably change the outcome as well. Okay, so this is an easy question. So tell me about, maybe why you decided to go into vascular surgery.
Sure. So I went into general surgery first, and one of the things I think that speaks to a lot of surgeons is the immediate effects that you can see from your therapy. When you do any sort of surgery, the patient sees that effect immediately versus treating blood pressure or cholesterol, where you're giving a medicine and waiting for months to see those results. So that spoke to me personally. And then as I did my surgery training, being exposed to the vascular surgery, especially the technology that's being developed with the endovascular procedures, that was fascinating to me. And I've really enjoyed doing those. I've enjoyed kind of being involved as that technology advances.
Yeah, I was about to say that sounds really cool as we progress as a society and just in medicine in general. It's just so fascinating to see how it evolves.
Absolutely.
Yeah. Okay, cool. So are you accepting patients right now?
Yes, we're absolutely accepting patients. My office is on Greenwood Road, associated with Willis, Knighton North. Our phone number is 318-212-8177. And we will be happy to see you and see what we can do to help you.
All right. So yeah, if you are interested, just call that number on your screen that you see right there and you'll talk with somebody to maybe get in touch with you, get something booked pretty quickly. How far out do you think that usually happens?
We're booking a couple of weeks out.
Okay, not
so
bad.
you'll speak with the office. We can, based on kind of that discussion, make a judgment on kind of the urgency of the visit, and then get you in as soon as we can make that happen and see what we can do.
And then lastly, with the acute PAD, if it's something that's life-threatening, you would probably want to go to the emergency
Yes,
room at that
either
point.
call 911, go to the emergency room to be seen immediately. Definitely do not wait for an appointment with me if you are can't feel your leg.
Right, exactly. All right. Well, thanks, Dr. Sugar. Thanks for joining us. Learned a lot about PAD. This will be posted on our website at ktbs.com/podcast, where you can then watch it or listen to it as a podcast. Thanks for joining us.